Meet Jonti Hudson, founder of Augmented Healthcare, clinical engineer and visionary doctor who's redefining what it means to practice medicine in the digital age. A doctor whose heart is in medicine, but his brain is also in engineering.
I was doing stuff that wasn't really my truest strength. You've always got to have your first failure. I went from being the med student that nips out, maybe has a nap, to being the last on the ward, doing all the notes. One of my best mates, who I actually flipped burgers for in his takeaway, he came to me and said, I've got this idea. I want to make like a Just Eat, but for takeaways to buy from their suppliers. That's when I taught myself how to computer program. And within 6 months, we had our first app in the App Store.
That's insane.
That was a really rewarding year.
Some may say it's a merging subspecialty over the horizon.
We're just seeing so many more medtech companies start up. The wide range of kind of problems that you can solve by using code is vast. AI has that ability to transform every single aspect of our clinical practice. One of the first questions that people ask is AI going to replace a doctor?
So to be honest, Dr. Jonti, I just wanted to start off from the beginning because your story is something that's lured me in with a lot of fascination. There's a lot to it. So where did it all begin? Can we take us back even before medical school? Who was Jonti?
So I really like to see myself as a true product of my parents. So my mum's an advanced nurse practitioner. She was one of the first advanced nurse practitioners. And my dad was a software engineer. He used to actually run some of the large projects at Sony Ericsson. Well, actually Ericsson before it even became Sony Ericsson. And then moved on to things like led the Oyster card down in London. So it's when I was growing up, there was always that sort of household of both medical but also technical. But then it really was me growing up and sitting there watching ER with my mum after rugby that really got me into sort of like sparked that curiosity, made me want to really start exploring medicine.
So why medicine? Because obviously you have a bit of a split in your household with a healthcare field and engineering. So it's almost as if your heart was there for medicine, but your brain's almost kind of wired for engineering in a sense.
Yeah, so looking back and now I've reflected on it over time, I've realized that one of the things when I was at secondary school, you're someone that's interested in the sciences, someone that's academically performing, someone that wants to sort of help people. The whole situation there was sort of geared to pushing people towards medicine. And to be honest, looking back, there never really was any exposure to anything else that kind of fulfilled that itch and that sort of purpose to sort of help people in a wider sense. And so, you know, even though potentially looking back, my sort of interests, especially in medicine, in maths, in physics, may have pushed me more down an engineering point of view. The gearing of what secondary school Lancaster Grammar was, go into medicine, and so that's the kind of career path that I went down.
Did you feel as though then going into medical school, that itch that you mentioned was fulfilled, or did you feel as though there was something else that you wanted and you were craving?
So it was interesting because when I was at med school, like I just never academically performed the same way I did in secondary school. So I was very used to being sort of a higher performer in secondary school, and then being at med school and being sort of, you know, middle of the road. It was a weird feeling for me, and it was because I felt that a lot of the time I was doing stuff that wasn't really my truest strength. I'm really big into sort of understanding things from those first principles, and a lot of medicine is remember this. Why? Because it is. Remember this drug. Why? Because it is.
That's a really good point you make, because sometimes you're almost compelled to just remember things for the sake of it, just because it is that way. It's almost like it's self-directed. It's from your own initiative that you dig a bit deeper. You try to understand why certain things are certain ways. And so did you ever feel as if you were in this situation, and how did you deal with that?
Yeah, so I've always been one that liked to go deeper on the sort of like the first principles. And I think that was why I was always drawn to sort of the neurology aspects, especially when we were looking at sort of the pharmacology of like kidneys and things like this. So it was always those deeper areas that I really enjoyed and gravitated to when I was at med school.
Yeah. So were you ever interested in particular fields whilst at medical school? You mentioned a bit of neurology and things and to do with the kidneys. So how was that?
So yeah, that was the part of medicine that I really, really enjoyed, was neurology. And actually, it's what led me to go and do my master's. And I did a master's in neuroimaging. So that was a really rewarding year, taking time out and actually doing a lot of work on fMRI scans. And it got me exposed to actually not full computer programming, but computer science, using MATLAB to do all of the sort of graphical interpretation of these scans.
Wow. So yeah, I mean, a lot of our viewers will be thinking, or maybe currently doing a year out, whether it's a master's or a bachelor's. So as somebody who has done it and can reflect on it from a few years back, how would you say it kind of helped you develop as a doctor today?
So interestingly, it was the main thing with the masters was getting that sort of understanding of science at a much deeper level. So I don't know about yourself or any of the listeners, but when you do medicine, a lot of the time, you don't really learn things so much as a scientist. So you may brush along it, but you don't really go into the scientific theory to the same depth. And that was something that, especially doing the masters, really was really helpful for. And I think that when you come out and you start going into your training, having something, and especially if it's something like a master's, does always make your seniors take note. And it was something that I've always looked back as a really, really good year.
Interesting. So when you finished medical school, on what position were you in? Was your mind directed towards any particular field? What were you thinking?
So looking back, it was probably like most people when they start, it's survive. Like you go in, and I always remember just going into that first year and not knowing what to expect. And you know what? It was such a brilliant first 2 years, but that all came down to actually, it's all about what you put in. So I'll be honest, when I was a med student, I might not have always been the hardest working med student, but when I got onto the wards, it all changes, because your patients are your responsibility. And so suddenly I went from being the med student that nips out, maybe has a nap, to being the last on the ward, doing all the notes. And the amount of skills that you just pick up in those 2 years, and the confidence that you get at the end of those 2 years by just going all in. But even still, I felt a little bit lost. Which speciality do I want to do? And so that's why I took a couple of years out, actually.
Yeah, so I want to talk a little bit about those couple of years, F3, F4 years. They seem to be quite pivotal in your story. You seem to have done a lot in those years that really shaped who you are today. So do you want to tell us a little bit more about that?
Yeah, so it was funny. One of my best mates, who I actually flipped burgers for in his takeaway during my master's, he came to me and said, I've got this idea. I want to make like a Just Eat, but for takeaways to buy from their suppliers. And we looked and we're like, no one's built this. And I was doing my F3, F4. I had time. I was working in A&E, but shifts were really flexible. And there was a part of my mind, even at that time, of potentially exploring a bit of coding. So we went, let's just go for it. So that's when I taught myself how to computer program. And it's funny, like, all the resources are out there. Like, if you decide that you want to do something like computer programming, there is Coursera, there is Udemy. These are all online resources, which, it's £15 for a course, and you just need a standard laptop and you can just get cracking. And that's what we did. We just decided we're going to go for it. And within 6 months, we had our first app in the App Store. Unfortunately, that business never materialized, because that's kind of when COVID happened. And so trying to launch a business during that time was nigh on impossible. But you know what? You've always got to have your first failure. And the amount that we all learned from it was just incredible.
Absolutely brilliant. So, on first impressions, when you hear from a doctor that they took some time learning coding whilst being in medicine, it might sound a little bit absurd. And so, why do you think that learning coding and being good with technology is something that's quite important, especially in the times that we're in now?
Yeah. So, the way that I see it is I'm an engineer. All right. So, software is the way that I solve my problems. And there is a new evolving term called clinical engineering. So that is people that have a clinical background, certainly medicine qualifies for that, that have gone on and done engineering. So why coding is really helpful is it's possibly the most versatile way of doing engineering. The wide range of kind of problems that you can solve by using code is vast. So by being someone that's a clinical engineer, you have this mindset and understanding of a problem that if you weren't deeply involved in medicine, you wouldn't even notice. And then where it becomes really, really powerful is when you start writing code, starting building code, there is no translational layer. So if you can think about the way that medtech is normally built, you've got the technology team, and then you've got the specialists, the subject matter experts. They've got to talk to the technology team. The technology team have to try it out. They've got to talk back. And there's this translational layer, and so much is lost in that translational layer. And it takes so much time to do that translational layer. So if you're someone that can do both, the speed and the quality of the code that you end up building is just vastly surpasses what normally is done.
Wow. So the role of a clinical engineer, some may say it's a merging subspecialty over the horizons. For those listeners who aren't too familiar with what a clinical engineer does, what the actual role is, and what the kind of opportunities that could be available in the future, what are they?
So I think that it is definitely an emerging area in the fact that we're just seeing so many more medtech companies start up. And funnily enough, a lot of the medical technology companies aren't even that aware of such a subset of an individual. And when I've gone out and sort of started posting and looking for jobs, I've actually found that I've gone and looked as a clinical lead. So you kind of go into these roles as clinical lead in a medtech company, and it was really when I was going for those roles that the clinical engineering side really was highlighted. And it was really funny because a lot of these companies weren't even aware. And it's when I put that on my CV, their light bulb went, oh, well, we could have you owning this whole process all the way from concept all the way to release. And it makes you very, very attractive to these companies.
And if we kind of loop back towards your role as a GP at the moment, how have these skills complemented what you do day to day?
Yeah, so I think there's a couple of things. One is it makes you acutely aware of the different ways that we could innovate. So I think that this is a really important point in the fact that, especially working in primary care right now, the system feels broken in a lot of ways, the wait times, the demand versus supply issues. And unfortunately, there isn't a group of doctors over the horizon to meet this demand, So we're going to have to improve efficiency. And one of the only ways in that is going to be innovation. And so whilst practicing and having the head of understanding how problems can be solved from a technological point of view, you find that you end up coming up with so many more ideas because you can fill in those gaps. So that's the first thing. And the second thing is it just means that you can actually be a lead in the current technologies that are coming out. And there's so many of those right now.
It seems to me that one of the biggest frustrations for people, whether they're current GPs or current medical students that may not want to go into GPs, the idea of having just a 10-minute slot to talk to a patient. 10 minutes to talk to a patient, try to figure out what's going on, try not to make any mistakes, and also document everything with precision. So at what point does technology and potentially AI play a role in what could improve the current system?
I mean, the reality is everywhere. Like, AI has that ability to transform every single aspect of our clinical practice in the same way that the internet has. So if you think about how the doctor of 50 years practiced and how the GP practice worked, from patient entering all the way to being discharged or being referred, like all of this is categorically changed with the internet. And the reality is AI is going to do the same sort of thing here. But this is why we're going to need clinicians that can advocate both from the clinician point of view, but also from the patient point of view of how that should appropriately be done. And we're only just starting to see this wave. And the where we're seeing it mostly at the moment is in these AI scribes. So like you said, at the end of the consultation, doing that scribing. And I know that I've personally had a lot of benefit from using Heidi. So I basically start that at the start of the consultation, and then I can turn to my patient. And I don't need to look at my computer. I can just give them the attention that they need.
It just writes it for you.
Yeah, so this is the thing, and this is where it becomes really interesting, is it's a AI, it's running what's called a large language model in the background. And so by understanding how those kind of systems work, you can actually start thinking about how best to do your consultation in the presence of one of these machines. So a good example would be when I'm doing an examination, I'm like feeling the tummy and I'm saying, oh, feels nice and soft, there's no masses. I'm actually signposting to the AI as well as the patient so that it can write the notes in a much better way for me.
That's insane. So surely everyone should be using that then.
So there's understandable concerns. And this is the thing. I mean, AI is a tool. And any tool can be used correctly and any tool can be used incorrectly. And so, there's been a recent push actually by Greater Manchester of blocking a lot of AI. And I understand those concerns, but I also feel that there is a risk there's always a risk when we do something and when we don't do something. So as GPs, whenever we give a medication, we're always balancing risk. Risk if we give it, risk if we don't. And this is the exact same when we're talking about AI. So there are risks. There's risks that it could incorrectly write down my notes and I could miss what it incorrectly wrote down. There's also risks of data security. Now, there's also risks if we don't use one of those systems and we're getting more and more overburdened. Do we miss writing something down normally? Yeah. And I can say that the notes that have been produced when I use Heidi are just incredibly more thorough than what I would normally write. And the referrals are of much higher quality.
That's incredible because it's almost as if whilst the AI makes the notes for you, you can also check them. If anything, in my mind, AI is almost like something that cancels out human error. And so why would the committees want to get rid of that? I just don't quite understand that.
So I think one of the big things is the fear of the unknown. This is a very new technology and not everyone understands how it's actually working from an underlying principle. So I can understand how, senior members of the sort of the teams that are involved in procurement and things like that might be very hesitant. But I think that this is, again, why we need to have clinicians that do have a specialist interest in this, leading these forward and actually learning and working out what the pitfalls are, what the quirks are, what are the best practices. And then actually that getting fed back into the community. And that's what I think is going to be happening over the next 5, even 10 years, is that we're going to need a lot of people that are technologically minded from a clinical aspect to bring that forward.
People like yourself then, eh?
Hopefully so, yeah.
Do you think that having these tools, having things like AI that can make the work of a GP potentially more efficient, can make the role of a GP more appealing towards medical students? Because at the moment it seems as though the 10-minute slots, the documentations is so off-putting to a lot of students. Do you think this can solve a lot of gaps in terms of understaffing and people not wanting to go into GP?
100%. So what I've been saying for years is I feel like we have been going through the hump of medicine in the fact that we've known for years and years and years there's been more to document. And we're suddenly starting to get to the point where that documentation is going to start to get automated. And so this is what I think is going to be happening is right now, yeah, it is so overburdened with how much we're supposed to be doing in those 10 minutes. But within the next 5 or 10 years, with the appropriate use of technology, it's about becoming an augmented clinician. So it's about having technology that works with the clinicians, but also the clinicians understanding how to use the technology in the same way that we use the internet, we use we use electronic patient record systems. GPs, clinicians of all kinds have had to adapt to the technology as well as the technology adapting to them.
Wow. For all those medical students listening right now, do you have any actionable pieces of advice you could give them to become better with technology? Is there anything out there that you might have tried or would be, willing to share?
So I think one of the first things with technology is it's about embracing it and playing with it a little bit. Of course, doing that in an environment that's sandboxed, that's safe. So it's about reading around whatever technology you're going to be using, trying to learn actually what's going on. Be a bit curious. In the same way you use your curiosity with any sort of aspect of medicine and you end up delving deeper into it and getting into a wiki hole or whatever, do the same with what interests you from a technology point of view.
Yeah, absolutely. And so in terms of the whole timeline of things, right, I feel like the point that we're in at the moment is one where AI is on the horizon. It's slightly stigmatized. There's not a complete trust in AI. And so if you could predict what's coming in the future, what's over the horizon in the next, let's say, 10, 20 years, what do you think the role of technology and AI can be in medicine?
Yeah, really good question. Because one of the first questions that people ask is, is AI going to replace a doctor? Like that's what seems to always be on everyone's tongue. And in my mind, I think that that's actually quite a stretch. So it's understanding that there's a big difference between AI as we have it now versus the kind of generalized AI that would be required to be able to replace the intuitions of what a clinician does. All right. Mm-hmm. So where are we going to be in the next 5, 10, 20 years? This is the moment where it's all about the augmentation. So this is where I do class it as the augmentation period. In the same way that we talk about self-driving cars, when they materialize, we don't know, but that's exactly my point. But what we've had for the last 5, 10 years is we've had augmentation in our cars. We've had lane assist. We've had that automatic braking. This is all AI in our cars, and it's the exact same thing that we're going to be having during the consultation. It's not going to be that replacement. It's going to be extra guardrails. It's going to be speeding things up. And where I see this really having a massive impact is potentially with our colleagues as well, our sort of allied health professionals, especially the advanced clinical practitioners that we already see in general practice. I can see that this is where we're also going to see assistance with some of their supervision.
Do you think getting to grips with technology and technological skills should be integrated towards a medical school curriculum in some way in the future?
I think that med schools should at least be open to it. So one of the things that was one of my frustrations was, even when I was doing my GP training, I tried to use some of my sort of CPD doing these kind of endeavors and was kind of shut down. Yes. So they didn't see the immediate impact of learning these skill sets. But that's because this role doesn't really exist. Where I see it existing in the future is very much akin to how med ed is. Okay. So what I mean by that is there's not going to be a speciality of clinical engineering within medicine. Just like there isn't a single speciality of medical education. It's you go down general practice and you can then do a extra flavor of med ed. You know, you can go down cardiology, do med ed in cardiology. That's what I can see it coming like, is that you go down your own subspeciality and you have that extra specialist interest in whether that be coding or at the very least something that's called digital clinical safety, which is a really, really important thing. And I'd encourage any aspiring technology med student to have a little look at.
Very interesting. That was a good breakdown, actually. It makes a lot of sense as to how clinical engineering doesn't have to be an exclusive pathway where you just leave clinical medicine and just go straight into the labs and into the computers and stuff. Very interesting. And so the next part is this. I heard you're working on something yourself, Jonti. Do you want to tell us a little bit more about that?
Yeah, so one of the things that I always felt really passionate about was when I'd learnt to code, I knew that this is what I wanted to do. I wanted to create innovation within clinical practice. And so that was one of the drivers why I ended up going down GP, because I knew that I could I could CCT in 3 years, and then I could go down to less than full time and allow myself to properly pursue my interests in technology. So that's what I've done. So the last 3 years I've been working less than full time and developing those additional interests and additional skill sets. And so the product that we're now looking to release, so I've started a company called Augmented Healthcare. And we're creating products that can help clinicians during the consultation.
How so?
So like we were talking about Heidi and how transformational Heidi has been, and it really has been. The issue is that is by its very nature post hoc. You know, it writes my notes and that's at the end of the consultation. Patient's already left the room. The question is what can we create that can be assistant during the consultation?
Right.
And so the technology for that is only very recently good enough. And what I mean by that is we've had technology that can take audio and turn it into transcribed text. All right. But it turns out that that's a lot more tricky when it's live. The reason being is it doesn't have the whole clip to take into context what each sound means.
Mm-hmm.
And so it's only very recent that we've had this technology that can take real life, especially medical transcription, and turn it into text. And so now what we can do is we can take that text and start running it through certain LLMs, so these are the large language models, and get back information that can be really helpful to me as a practicing clinician.
Wow. So what are some of the huge impacts that this could make? What can you foresee if people start to use apps like Augmented Health?
So the ones that we're looking at launching with is we're wanting to do automated values. So what I mean by that is every GP out there will know about the frustration. You ask a patient, how tall are you? And they say 6'1". I need it in metric. And then they get their weight. What I want is the BMI automatically calculated. I want, when I'm talking about Wells score, it bringing up the questions that I need to ask and it automatically calculating. These are the things that I want. I want, when I'm talking about the when I'm talking to the patient, I'm wanting the quick links to guidelines. I want a much better search engine than Google. I want it already there based on what the consultation is. So if I need to check, I can click on it and look. And then lastly, we're creating a model that can listen to the consultation and pick up when there is a red flag topic and basically say, these are the other questions that you need to ask.
Wow.
And so this is what we want to do at launch. Now, that's where we're at now. The question is where do we want to go? And where is the future of these things? And so we're talking about things that can then give guidance. Now, the thing here is the more we do that can influence a decision, the more risk there is. And so we're very, very clear that we need to be baking in clinical safety from the beginning. And this is something that's really, really important. And so what we're doing is we're having a clinical safety team that oversees everything. And we're building these models, and we're actually going to be testing them in like an OSCE style situation. And then in the horizon, what we really want from systems like this is integration with our electronic patient record system. What you want is when you're seeing your patient with a UTI, I want to see when was their last UTI. I want to see what was their last MSU automatically coming up on the screen, pulling up all the relevant information from their history so that I can pay more attention to my patient. I can rely more on what my intuition is, those subtle cues. That really, that's where the benefit of being a qualified medic, qualified GP really is. And then let the AI do what it does best, which is interface with the world of knowledge.
Incredible. How do the members of public perceive this? So from your experience of using things like AI transcribes, what is it like when you tell someone, look, I'm just going to speak to this robot who's going to type up everything whilst I look at you? Is it generally positive, or are they kind of weirded out?
That's such a good question, because what I've actually found is most people aren't bothered. Then there's a subset of people that are a little bit hesitant, but then your follow-up question is, well, your follow-up response really is, well, now I can give you my full attention. And they love it, because actually that's the thing that this technology should be doing. Is it shouldn't be taking apart from the patient interaction. It should be allowing us to get back to more of that patient interaction. I think that there is work to be done, a lot of work to be done, but this is why we need to be involving our patients. We need to be understanding what their needs and concerns are. And it's another reason why we need those specialists. So people that are going to be clinical engineers to be taking charge in this, to be advocating and building technology that has the trust in our patients.
Brilliant. So from doing your CCTs to now becoming a CEO, what have you noticed has changed into your life? Was there anything that surprised you in the world of business, or were there any overlaps that actually were like, oh, wow, my medical skills actually helped me with this?
So certainly doing PBL at Manchester Med School was a real help, because what that taught me was to go away, find out that information and learn it. And so that skill set from med school has been really, really helpful. And also I think that one of the other things is that medics often come to problems from a different angle than what a lot of people in the business sphere come at. So it can be really helpful when you're in those kind of meetings, the kind of insights, especially if you're creating something that's med tech, that you have such deep understandings of how healthcare works from patient through to systems that you can offer so much insight. And the other thing that I found that always took me back was just the sheer amount of respect that you immediately have when you get into these meetings. So you can be sat in these meetings with very senior individuals, and as soon as you've got your GMC, you're taken so seriously. And so that's something that, is a real positive for anyone that's doing medicine thinking of going into the field.
That's brilliant. And in terms of overlap, was there anything within your medical skills, your clinical skills, that have helped you, let's say, in decision making or managing people at all?
Yeah, I think that often you sort of take those things for granted because they get so ingrained into your own style that you don't really think about it. One interesting area, though, was a bit of conflict, was when you're working in practice, working in the hospital, one of the things that's interesting is that you are often sort of in scenarios where you're working so much as a team that now I'm a CEO and I'm expected to just make calls and be the person that has to make the call. It can often feel a bit alien. And sometimes you're in a position where you're sort of all discussing it so much that they're kind of like, Jonti, make your decision. And you've got to go, okay, yes, this is what we're doing. But otherwise, it's the confidence. It's the confidence that medicine gives you.
Yeah, 100%. The biggest question I have right now in my mind is, how does someone like you manage their time in both, being a doctor and also having a business and developing an app for it and hopping on podcasts, doing everything else as well? What are some of the things that you do to manage time?
So I think it's a funny one. I think that one of the things I always joke about is I always say to people, find your passion. But the problem is when you find your passion, it's balancing obsession. So I think that, one of the things that I do is I end up working 70-hour weeks, but it doesn't feel like I'm doing that, because it's like the person that's interested or has a passion in art. They'll do a full day in art, in the hospital. They might go back and they might do drawing, and it's that kind of relaxing, therapeutic kind of aspect. That programming, if that's the kind of thing that you're into, you can do that without it feeling like you're burning out. And it's actually helped me a lot of the time manage burnout. And I think that if I was working full time in GP, that's something that I would struggle with. And being able to step back and do a bit of coding actually is my relaxation.
Do you think that going into GP is an ideal specialty for individuals who have a like-mindedness to you, where they want to explore different fields, let's say tap into business and entrepreneurship?
Certainly. I think that there are benefits for doing it in specialities, but by and large, the shorter time to CCT, the abilities to work less than full time quite soon after med school comparatively really lend itself for you to be able to explore these other avenues.
Brilliant. So yeah, this has been absolutely fantastic so far, Dr. Jonti. For those who are still listening here, who want to explore fields such as the ones that you have, who want to get good with technology, who want to think outside of the box and become innovative, what are some actionable advice that you could give for those who want to go on and do something similar to this and also create a global impact?
So what I usually recommend is think like an engineer. So what is an engineer? An engineer is someone that just solves a problem. Okay. So be led by the problem. I don't usually advise people to just go and learn coding. You're not going to enjoy it. You're not going to keep at it. Coding is the tool to solve the problem, whatever that problem may be. So what I normally recommend is have that curiosity. Scratch whatever that itch is, follow that hole of wherever that goes. It's about keeping your eyes open for the problems. And there is a lot of them, And so that's what I would advise people to do, is keep their eyes open for what that problem is and really tunnel down what are the skill sets that I need to learn to be able to solve that problem. Now, if that means that I have to learn coding. If that means that I have to then learn database design, I have to learn database design. And so that becomes an afterthought. And what's really interesting with that is you'll find that you'll go on a resource, you'll learn a resource, and you'll get about 20, 30% through, and you'll be like, I can pretty much solve my problem now. Next. And it keeps that momentum up. So that's what I usually recommend, is look for the problem, and you're solving the problem in whatever way you need to.
Fantastic. And it's almost like you're describing no distinction between the work you do and play. What I mean by this is, to prevent burnout, you can't be viewing work as this chore that is draining you out, and it's something that you need to do in order to enjoy. You've almost merged the two together, where you are enjoying work, you've dipped it into enjoyment, and you're carrying action out through that lens. So is that something that you really parade and you think that should be done by more people?
Oh, 100%. Like this, if you do coding and you find that it's the thing that you really enjoy, and I speak to other people that have got into software engineering that are exactly the same, it doesn't become a chore. It becomes something that you look forward to. It's the kind of thing that I can wake up in the morning before a shift and put an hour in, and it's not like I'm being pushed to do so. It's creative. No one's telling you how to solve the problem. You've got to work it out. So I'm not an artist. I've never been good at drawing, but you really feel like you can do sheer creation when you start doing your code.
So yeah, at Medic Launch, we're also trying to catch up with the times and keep up with the technology that's growing. We're actually trying to integrate technological instruments into the site itself in aims to empower medical students and medical education within the software. Where do you see technology playing its role in platforms such as Medic Launch?
So you see how tech has absolutely transformed education from when I've been doing my software engineering and done all of my learning online. And what that shows is if you get the right kind of ways to describe education through sort of a platform that has videos, audio, interactions, there isn't a ceiling to what you can learn, and I've actually found sort of online education as the thing that has actually helped me transform my whole life and my whole career. So the fact that we're getting more of that in medical education, I think, is an amazing thing.
Dr. Jonti, it's been an absolute pleasure. You've been incredible here. Thank you so much for your time.
No, thanks for having me.